This is RX Knowledge and my name is Tahir Malik. Hi guys, how are you? Hope you all are fine. So coming on to our main topic, that is alpha-adrenergic agonists. So these are basically the classifications of alpha-adrenergic agonists. You can take a screenshot if you want. Let's take a screenshot. Okay, so coming on to today's topic, that is adrenergic agonist. The first subclassification is direct acting agents, that is, it directly acts on the adrenergic receptors. The first set of drugs are albuterol, formoterol, and indacaterol. So these set of drugs are LABAs, that is long acting beta adrenergic agonists. They are used for the management of asthma and COPD. COPD is basically chronic obstructive pulmonary disorder. We will talk about this in detail in later stages. So the important thing about these drugs is it is very efficacious when inhaled with corticosteroid. So albuterol, formoterol, and indacaterol, when given with corticosteroid, it increases their efficacy. So the next drug is clonidine. So mechanism of action of clonidine is it is alpha-2 agonist. It also inhibits sympathetic vasomotor centers. It decreases outflow to the periphery. Clonidine treats hypotension, and the main important thing is that I want to tell you is it decreases the withdrawal symptoms. Clonidine is used for the decrease of withdrawal symptoms. That is very important. And another important thing is clonidine when given with guanfacine, it treats ADHD. So guys, ADHD is basically attention deficit hyperactivity disorder. It causes trouble with paying attention, controlling impulses, and getting along with others. So clonidine plus guanfacine is used to treat ADHD. The next drug is dobutamine. So when it comes to mechanism of action of dobutamine, it is beta-1 receptor agonist. That is, it decreases cardiac output in acute heart failure. It also causes positive inotropic effect. So positive inotropic effect, basically it makes your heart muscle contraction stronger, raise your cardiac output to normal level, and also increases the amount of blood your heart can pump out. So it causes positive inotropic support after cardiac surgery. So dobutamine also has some side effects. It increases AV conduction. So we should be cautious in patients with atrial fibrillation when giving dobutamine to these patients. So this is very important, guys. The next drug is dopamine. Mechanism of action of dopamine is it causes positive inotropic effect and positive chronotropic effect. We have discussed about positive inotropic effect. So positive chronotropic effect is basically increase in heart rate. Dopamine also increases blood flow to kidneys. Dopamine has both alpha and beta stimulation. It is vasoconstrictor at higher doses, and dopamine also stimulates beta-1 cardiac receptors at lower doses. It is very important, guys. Vasoconstrictor at higher doses and stimulate beta-1 cardiac receptors at lower doses. Dopamine also used to treat cardiogenic and septic shock. It is also used to treat hypotension and severe heart failure. Dopamine also used to treat bradycardia unresponsive to others. That is, if the bradycardia cannot be treated with other drugs, give dopamine to that patient. The next drug is epinephrine. Its mechanism of action is it affects on cardiovascular system. That is, it increases contractility, which means it has positive inotropic effect. It also increases the rate of contraction, which means it has positive chronotropic effect. Combinedly, it is because of beta-1 stimulation. Epinephrine also causes renin release. That is because of beta-1 stimulation. Epinephrine also dilates vessels going to liver and skeletal muscles because of beta-2 stimulation. Its mechanism of action is it increases systolic pressure, slight decrease in diastolic pressure. It is bronchodilator because of beta-2 stimulation. It also inhibits histamine release. So the important thing is epinephrine is it causes hyperglycemic effect. It also causes lipolysis. Epinephrine is used to treat bronchoconstriction, anaphylactic shock, especially type 1 hypersensitivity reaction. That is very important. Epinephrine also used to treat cardiac arrest. it causes and maintain mydriasis. That is very important too. Epinephrine is used to cause and maintain mydriasis. Epinephrine has some side effects too, some CNS effects, also cardiac arrhythmias and pulmonary edema. Epinephrine also causes tachycardia. It increases blood pressure and increases peripheral resistance. The next drug is phenoldopam. Its mechanism of action is it is D1 receptor agonist. It is used to treat severe hypertension in hospitalized patients. Phenoldopam also has some side effects. It causes headache, flushing, dizziness, and tachycardia. The next drug is isoproterenol. So isoproterenol has mechanism of action, that is it stimulates beta 1 and beta 2 adrenergic receptors, but it has no effect on alpha stimulation. Isoproterenol also increases heart rate, it increases contractility, and also increases cardiac output. Isoproterenol also dilates arterioles of skeletal muscles because of beta 2 stimulation. It decreases peripheral resistance. Isoproterenol also increases systolic pressure. It greatly decreases diastolic pressure. This is very important in terms of MCQ, that isoproterenol greatly decreases diastolic pressure. The next set of drugs are salmeterol, metoprolol, and terbutaline. So these set of drugs are basically SABAs, that are short-acting beta-adrenergic agonists. So when we talk about salmeterol is used to manage acute asthma. So guys, basically these set of drugs, salmeterol, metoprolol, and terbutaline, are also bronchodilators. So when we talk about terbutaline, it is used as uterine relaxant to suppress premature labor. This is very important. When we talk about terbutaline, you should know that it is uterine relaxant. We have also some side effects of these set of drugs. That is, it causes tremor, tachycardia, arrhythmias, restlessness, apprehensions, and anxiety. The important thing in this is these drugs causes tachycardia when given orally, and also arrhythmia because of beta 1 receptor activation. They causes arrhythmias because of beta 1 receptor activation. The next drug is midodrine. So when it comes to mechanism of action of midodrine, it is an alpha 1 stimulant. It increases atrial and venous tone. Midodrine is also used to treat orthostatic hypotension. It is very important. Sometimes we have an MCQ, what drug is used for orthostatic hypotension? So if there is a midodrine option, you have to take that. The midodrine also have some side effects, that is supine hypertension. So supine hypertension is basically high blood pressure that occurs when person is lying down, typically during sleep or rest. So the important thing is, do not give midodrine within 4 hours of bedtime because of supine hypertension. The next drug is mirabegron. Its mechanism of action is it is beta 3 stimulant. It relaxes detrusor muscles. It increases bladder capacity. Mirabegron also used to treat overactive bladder. Mirabegron has side effect too, that is it increases blood pressure. The next drug is norepinephrine. Its mechanism of action is it affects on cardiovascular system, that is increases peripheral resistance, it increases systolic pressure, increases diastolic pressure, and increases blood pressure. It also causes reflex bradycardia. So the important point is we should give atropine with norepinephrine to counter reflex bradycardia. That is very important, guys. So it is alpha adrenergic stimulant, that is it causes tachycardia, that we have discussed. To counter tachycardia we give atropine. So norepinephrine, when it comes to treatment, it is used for the treatment of septic shock. The main important thing is norepinephrine should not be administered in peripheral veins. Sometimes impaired circulation from norepinephrine can happen. So in this case, treat with phentolamine, terbutaline, and topical nitroglycerin. This is very important. Norepinephrine has some side effects too. That is, it causes potent vasoconstriction. Because it is a potent vasoconstrictor, it causes blanching and sloughing of skin along injected veins. That is, it causes extravasation and necrosis of the tissue. The next drug is oxymetazoline. Its mechanism of action is it is alpha-1 and alpha-2 stimulant. It supplies mucosa and conjunctiva, that is, it decreases congestion. Oxymetazoline is used as decongestant and relieve redness of eye. This is very important characteristic of oxymetazoline, that is, it is used as a decongestant and also relieve redness of eye. Oxymetazoline also have some side effects, that is nervousness, trouble sleeping. There is also an important thing about oxymetazoline, that is, do not use oxymetazoline for more than 3 days because it causes rebound congestion. The next drug is phenylphrin. So when it comes to mechanism of action, it is alpha-1 stimulant, it is vasoconstrictor, it increases systolic and diastolic pressure. So when it comes to treatment, phenylphrin is used for the treatment of paroxysmal supraventricular tachycardia. So it is basically a type of arrhythmia in which there is irregular heartbeat. So it is used for paroxysmal supraventricular tachycardia and also severe hypotension. Phenylphrin is oral decongestant and it causes mydriasis. So the next subclassification is indirect acting agents. The first drug is amphetamine. Its mechanism of action is it is alpha-1 agonist on vasculature and beta-1 on heart, that is, it increases blood pressure. Amphetamine also releases catecholamines or increases the levels of catecholamines, that includes dopamine or norepinephrine. The next drug is cocaine. Its mechanism of action is it blocks sodium and chloride ion depolarization. It also blocks norepinephrine transportation, that is, it increases norepinephrine. And it is also alpha-1 and beta stimulant, that is, it increases blood pressure. The next drug is tyramine. Its mechanism of action is it is oxidized by monoamine oxidase in GI. It releases catecholamine. Tyramine has some side effects, that is vasopressor episodes. So vasopressor is basically when there is a sudden spike in blood pressure. The last subclassification is direct and indirect acting agents that have mixed actions. The first drug is ephedrine and the second is pseudoephedrine. So these set of drugs have similar mechanism of action, that is, it increases norepinephrine and it stimulates alpha and beta receptors. When it comes to ephedrine increases systolic and diastolic pressure that combinedly have vasoconstriction properties. Ephedrine also used as bronchodilators. When it comes to treatment of ephedrine is used to treat anesthesia-induced hypotension. When it comes to pseudoephedrine is used to treat nasal and sinus congestion. So that's all from me. Thank you very much.